The implementation of new tariffs threatens to make healthy eating even more expensive and inaccessible for millions of Americans, exacerbating an already dire public health crisis. While the administration may claim these measures are necessary for economic or trade-related reasons, the reality is that they will have an immediate and lasting impact on the affordability and availability of nutritious foods. With food insecurity already affecting nearly 1 in 8 Americans, and many communities struggling with food deserts, increasing the cost of fresh produce, nuts, seafood, and other essential components of a heart-healthy diet will likely push more people toward cheaper, ultra-processed alternatives. The data on American dietary habits is already concerning. According to a recent study, over 30% of Americans consume a poor diet by the standards of the American Heart Association, while fewer than 2% maintain an ideal one. The reasons for this are well documented. Healthy food is expensive, often difficult to access, and in many cases, unfamiliar to those who have not grown up with it. Many of the most nutritious foods, tomatoes, avocados, peppers, berries, nuts, and seafood, are primarily imported from Mexico, Canada, and China, all of which are directly targeted by these tariffs. When these prices rise, lower-income households, already facing financial strain, will be forced to make rational economic decisions, opting for cheaper, calorie-dense, and nutritionally poor foods that contribute to obesity, diabetes, and heart disease. Despite the appeal of supporting local farmers and reducing the environmental impact of food imports, the idea that the U.S. can suddenly shift to a completely self-sufficient food system is unrealistic. The current agricultural landscape is deeply intertwined with global trade, and any attempt to decouple from it abruptly will lead to chaos rather than meaningful reform. If the administration were truly interested in promoting a sustainable, locally sourced food economy, it would invest in policies that support domestic farmers, increase subsidies for fresh produce, and strengthen food assistance programs rather than dismantling them. Instead, the approach taken thus far, escalating trade wars, cutting funding for nutrition programs, and placing unqualified individuals in key health policy positions, suggests a complete disregard for public health and well-being. However, while these policies present significant challenges, individuals and communities still have opportunities to take proactive steps in maintaining a healthy diet. Shopping at local farmers markets, joining community-supported agriculture, CSA, programs, and prioritizing whole, unprocessed foods can help mitigate some of the effects of rising prices. Advocating for policy changes at the local and state levels, supporting initiatives that increase access to affordable fresh food, and raising awareness about the long-term health implications of poor dietary choices can also contribute to broader systemic change. It is crucial to recognize that food policy does not exist in isolation. These tariffs are part of a larger pattern of decisions that undermine public health, from attacks on Medicaid to cuts in global health initiatives. The consequences extend beyond diet alone, affecting access to medical supplies, prescription drugs, and life-saving treatments. If the trajectory of these policies continues, Americans will not only face higher grocery bills, but also a healthcare system increasingly burdened by preventable chronic diseases. This is a moment that calls for both awareness and action. While individuals can take steps to maintain healthy habits despite these challenges, the broader issue requires collective advocacy for policies that prioritize public health over short-term economic maneuvering. If the cost of nutritious food continues to rise unchecked, the long-term consequences will be devastating, not just for individual households, but for the overall health of the nation.